Welcome to another edition of Ask NP Deidre with Nurse Practitioner Deidre Arms. Today we're going to be talking about B vitamins and the connection between cardiovascular disease and peripheral artery disease and B vitamin deficiencies. Welcome, Nurse Practitioner Deidre. We really appreciate you always being here on a weekly basis and answering questions about all different types of supplements. But in particular with B, we get a lot of questions about B vitamins because so many of our patients end up with neuropathy, especially. We have others that have some sort of a gene mutation, which there are a lot of patients that don't even know they have this gene mutation until sometimes it's too late. They end up with damage to their artery walls. They end up being diagnosed with peripheral artery disease, cardiovascular disease, and nothing they seem to do actually helps to stop the damage from happening. And then in comes Nurse Practitioner Deidre, who says, aha, have you had your B vitamins checked lately? How did you discover that B vitamins were such a key player in cardiovascular and vascular health?
Well, there's a lot of evidence and research that's been done on B vitamins, specifically your B6, your B12, and your folate, which is B9, because we know that they play a critical role in supporting heart disease and peripheral artery disease. So we know in the studies that it can improve endothelial function, it can reduce inflammation, and it helps to lower homocysteine levels. So when you said, I check B vitamin, well, that's just not enough because you can look at your B vitamin and you still don't have the answer of if you have enough B vitamin. So checking a homocysteine level, and also that gene that you're talking about, the MTHFR, or like we like to call it, the mother effer gene, is one that is associated with this lower B vitamin.
And when you mention homocysteine, so homocysteine is an enzyme that if there's too much of it in your blood, my understanding is it's like nails on your artery walls, which leads to plaque buildup. Is that accurate?
That is very accurate when it comes to homocysteine levels. So homocysteine rises, it's an amino acid, and as it rises, it becomes toxic to the blood vessels. So that increases the plaque buildup, the endothelial damage, which is the lining of the blood vessels, and it increases clot formation. So elevated homocysteine really is an independent risk factor for PAD, stroke, and heart disease.
And so your general B vitamin levels don't say enough. Do you have blood tests that not only show the levels of B vitamins, but also is it different for B vitamin absorption? Are those two different tests?
Right. So when you're looking at, most providers will do a B12 level and folate. And so when you look at your B12, that can look normal, but it doesn't always tell us, are we pulling it into the cell? How are we utilizing it? And so the homocysteine level with the B vitamin gives us more information, right? Most people should have a homocysteine level under 10. Right? Optimal is probably 7 when we're looking in my world of functional medicine and to really optimize things. And anything over 15 is what we call hyperhomocysteine, meaning a true elevation in homocysteine levels that can really affect the cardiovascular system.
And the MTHFR that you mentioned, the mother effer gene, how does that end up impacting the B vitamin levels, which ultimately end up causing the homocysteine levels to rise? How does that whole process work?
So MTHFR, it is a gene that is associated with the breakdown of folate. And so when we're looking at it, people who have this reduced enzyme of MTHFR, they have a difficult ability converting folic acid into the active form of L-methylfolate. So we see higher homocysteine levels in this. We also see as a side effect or anxiety, depression. So this is also studied not only in cardiovascular, but as it relates to anxiety and depression as well. And so we know that people who have this elevated, like MTHFR, that they have this and they have elevated homocysteine levels, that they respond to a specific type of B vitamin, not just your regular B vitamin.
So can you talk about the type of B vitamin that we need?
Right. So that would be considered a methyl form of B vitamin, right? So not all B vitamins are equal. So your over-the-counter B vitamins contain kind of synthetic folic acid or cyanocobalamin. And this is where we have trouble with these ones because there are 5 steps on how we break folate down to the active form. And when you're using these synthetic folic acids or cyanocobalamin and you have this variant of MTHFR, right, you're doing that very ineffectively. And so you want a methyl form of B vitamin so that it bypasses those middle steps and it helps you deliver like to the active form, making it more efficient and more effective in the body.
Does it make any difference whether you are taking a B vitamin, a methylated B vitamin, um, or just in a capsule, or whether you're doing it liposomal, meaning dissolving underneath the tongue?
So liposomal is a great way because it's rapid absorption under the tongue. Some things when I am talking to my patients and what I'm thinking about is how is their absorption? How is their gut motility? If you're not having a bowel movement every day and you have slow GI and constipation, well, getting a vitamin in an oral form via a pill, you may not get the effects of it as rapidly as if we did a liposomal.
And what about prescription strength B vitamins? I had discovered this just in December. And for my dad that had neuropathy in his feet, he had one of those tests where they poke the foot and he wasn't able to feel certain toes. And he's been on this prescription B vitamin and he has the MTHFR mutation. The homocysteine levels were actually normalized through just being through a liposomal, but he still had this neuropathy in his feet. And he went on this prescription strength B vitamin. And he just went back now 6 months later to have that same test again. He has full feeling back in his toes. How is this
Yeah.
possible? I mean, this is incredible. I didn't realize that B vitamins were that powerful.
No, they really are. So the prescription one is called Medinex that you're talking about. And we consider it medical food because it's designed to target the endothelial dysfunction and reduce homocysteine levels. And there are quite a few studies on it. And what's in Medinex is L-methylfolate, which is the active form of folate. And it has P5P, which is the active form of B6. And it has methylcobalamin, which is the active form of B12. And so these are bioavailable forms of B vitamins, meaning that they are already in a form that your body uses and doesn't require conversion by that enzyme like MTHFR.
And you have your sister who's here, who is someone who's had a great experience with B vitamins. Do you want to introduce her and walk us through her story?
Yeah, so this is my sister, Ange, and she um, had an experience with peripheral artery disease, and Dr. Phillips was one of her doctors, and she can tell about her story. But one of the things that we started her on was the Medinex, and she has a great story about this and how well it worked for her. So I would really like you, Ange, to kind of share with the audience your experience with how well did Medinex work for you, and like, are you still using it?
So it worked very, very well for me. And like your father, I have complete feeling back in my feet. And I thought it was damage from diabetes because I've been a diabetic since I was around 19 years old. And so when I started to have some of that numbness I kind of chalked that up to neuropathy due to diabetes. And then once we figured out I have, some vascular things going on, Deidre prescribed me the McNicholas, and it was probably within a couple of months. It was like night and day. If I didn't take it immediately, I could tell and I could double up on it. And then all that feeling would just come back. So it just kind of was a superpower drug for me. And I don't take it at this point. I just feel like I have kept up on all my vitamin levels and I get those checked regularly, and all that feeling's back in my feet. So it kind of changed everything for me. And as far as now, I don't really need it for now, but if I need it, I would definitely go back on it.
So it's not something that you may need for forever and ever. It's just something that maybe can get you back up, back stabilized, and then you can go back to the over-the-counter liposomal vitamin B vitamins. Is that what I'm hearing?
Yeah, that's actually how we do it. We want to make sure, like, so I know Angie's medical history, and she does have the MTHFR gene. Pretty much everybody in our family does. And so I knew right then that she had trouble with converting that B vitamin. So we really wanted to get the high quality of it. She also had some revascularization with Dr. Phillips. And so all the hard work that she has put into that, things that we always tell patients, the aggressive walking and doing things to like rebuild your collaterals and everything, coupled with this, was really a great success story for her.
That's amazing. I'm curious. One of the Tracy who's listening in right now from the UK is wondering if this is available in the UK. That I don't actually know the answer to that. It would be a quick Google search to see if it would be offered, but I would imagine that it is a prescription drug that whether or not the UK offers it as part of their service, I don't know.
So as it relates to Medinex, I do know that it is currently unavailable only in the US is where you can get it. However, there are options for people in the UK, and especially with those professional grade brands like Thorne, Pure Encapsulations, Seeking Health, they have methylated B forms. The beauty of Medinex, and I've done a lot of research of looking at Medinex compared to some of the other brands, is they have a much higher dose of these vitamins in the active forms of the B vitamin. And so sometimes if you're taking one of the other professional grades, they're not considered medical food, so the dosing isn't as high as Medinex, but sometimes you could take one or two of those for this.
So is that something that you can overdose on? I mean, is it one of those things where you can have too much of a good thing, or is it like with vitamin C, you end up urinating it out?
Very much like vitamin C, you do urinate out your B vitamins. So if you have great kidney function, then you are, urinating well. You don't get an overabundance of it. B vitamins always is the vitamin that makes your urine look a little bright yellow, bright orange. And that doesn't mean anything's wrong or something's wrong with your urine. Like, that's just what the B vitamins do.
And so if you do have, I think it's important to note, you mentioned people with poor kidney function. If you have chronic kidney disease or you have end-stage renal disease, it is important to consult with your doctor to ensure what level of B vitamin, if at all, you should be taking. That goes for anyone, however, who is listening. Before you do on any information provided here, that you do get explicit consent from your own healthcare provider to determine what is right for your presentation of disease. And it's really important, as we always mention, that you do get those blood tests. And with every supplement and medication regimen, we suggest having a consult with your doctor every 6 months to a year to get the additional blood work to ensure, number one, are your medications causing any nutrient deficiencies? And number two, what are the nutrient deficiencies, whether they're related to your medications or in general related to your disease? So But with that, we always talk about the supplementation, but what about foods? Are there different foods that you can just get naturally that have a lot of B vitamins in them?
Lots of foods with B vitamins, especially your leafy greens and your vegetables, fruits and things like that. So I say your single source foods have a lot of great B vitamins that you can eat, and especially like your spinach, things like that.
And are there any foods, I know for me, in having the MTHFR mutation, that I have to stay away from enriched foods, enriched flour, things that have, I believe, enriched with folic acid. So a lot of the breads and the pastas are completely out for me. Would you mind walking us through the foods that we need to avoid and um and why?
So processed foods or enriched foods like that, they have the basically what I call fake folate, right? And so if you have that MTHFR gene, then your body is not processing that folate correctly. And so those are the foods you want to stay away from. I tell people when I see this gene, and I always say, just because you have the gene doesn't mean it's turned on. But let's break it down for our patients who have PAD and cardiovascular disease. So about 50 to 60% of those patients actually have MTHFR. So that's how you kind of know the gene's turned on, because you have the cardiovascular disease. You have, even with anxiety, we say that the gene's turned on. Just because you have the gene doesn't mean it's expressed. And so when you give fake folate, you basically, your body doesn't know what to do with that. And so you can have like increased anxiety from it. You can have increased inflammation in the body because of it. And so avoiding those foods and really sticking with the single source foods like spinach, mushrooms, avocado, omelets, your grilled salmon, steamed greens, brown rices with chickpeas, sunflower seeds, your sweet potatoes, like all of those are great sources of B vitamins that do not have any enriched sources.
And I know here, and I'm sure I'm going to be getting a lot of questions about this because we haven't specifically addressed the actual test for MTHFR. If you've had any sort of genetic testing, for example, through 23andMe in the past, there are formulas online that you can use to figure out if you do have this MTHFR gene. You can get a test, at least here in the US, for it. It's expensive, but you can tell, right, Nurse Practitioner Deidre, if one, you have cardiovascular disease, right, peripheral artery disease, probably 50-60% likelihood it might be turned on. So worth making sure that you are getting the test that you need for the B vitamins and the homocysteine. But if you, at the very least, just simply go in and you say to your doctor, I want to check my B vitamins, my folate, and my homocysteine, depending on those levels, especially the homocysteine, right? If those are really high, chances are you do have this mutation that is expressed and it's doing something, and it's worth having the conversation with your doctor about increasing the B vitamins and making sure that you do have a methylated version.
Exactly. That's what I tell everybody is follow the homocysteine level. We want it to trend down. We want it to be lower. That B vitamin can look normal in people. That's why I say it's not the end all be all when you're doing a blood test. So when you're looking at the B vitamin, that range can be like 290 to 1200 depending on which lab you're doing. And so anything under 300 is actually linked to dementia, Alzheimer's. So if you're getting these low lying levels of B vitamin and your provider saying that's normal, really question, can they do the homocysteine level and look at that?
And so when you're looking at these supplements, I mean, I don't know, do I want to be complex, a methylated B complex? Do I want a specific, I know they have versions that are specific supposedly for MTHFR. how do I choose a B vitamin just in general, even to be on the safe side?
Right. So if you're looking at choosing a B vitamin, um, looking at the methyl form. So if you're trying to really target the PAD and cardiovascular, what we know and what's been studied is L-methylfolate, P5P, which is active B6, and methylcobalamin, which is active B12. So those three things help with targeting and reducing homocysteine levels. So you would want something with at least those three things in it, which typically comes in the form of a B complex, a methyl B complex.
And we have Sherry that's asking about, she was on a high dose of gabapentin and started the B1 and she stopped getting, I'm not sure what she means. I guess she got a little neuropathy because she has trigeminal neuralgia. And so I'm not sure, she doesn't have a question on there, but I am curious. B1, what do B1 vitamins, B6 vitamins? I hear that a lot with some of our podiatrists. Oh, she says she's also on Metanix. Oh, that's great. That's good as well. But B1 and B6, I have quite a few podiatrists that actually tell patients that they should be on it for their neuropathy.
Yeah, well, B1 thiamine supports your nerve and muscle function, right? Gives you energy, metabolism. And then your B6 or P5P actually is the one that can help reduce your homocysteine levels and it supports nerve function. And so B6 also on the cascade of your neurotransmitters is a precursor to serotonin as well. So mood can be really benefited by having the right kind of B6 vitamin as well.
And so Becky is saying, as she's listening to this, so B12 isn't enough?
For PAD and for testing, like you could have, if you did a blood test, you could have your B12 looked at and it could look normal, but the homocysteine level could be really elevated. So you want to couple those tests together to know.
What about this supplement?
Oh, with the supplement, so B12 is a great supplement, but if we're really targeting PAD, like we know the studies support having those three together, the L-methylfolate, the methylcobalamin, and P5P.
And, with the Metanix, it's not available. You have to get a prescription, but it's not generally covered by most insurance and costs a fortune, $200 a month. It's good to hear that Ange, your sister, did not have to be on it for forever and ever. But you have a tip and trick for getting it at a little bit of a discount if patients need to be on it at least, for a few months.
I actually do, and this is what I would tell all providers who are writing this script. And I don't speak for the company. I just have this experience. So, when you order Metanex, you want to do it through their brand direct pharmacy in Tampa, Florida, and you want to write it for 90 days. So then it ends up being for the 90 days, like $175. They have a coupon to bring that down. But one thing about ordering through brand direct, if it does not work for you, they will give your money back. So, and I've had the patient experience with that, and they are true to their word about that.
That's incredible. And that's actually thanks to you. That's where my dad gets his. And he actually is at a point where his B vitamins are pretty high, which is incredible. And his doctor is very, very happy. He not only has the improvement in his neuropathy in his feet, but also he's a little bit more on it. He feels like he's not as fatigued and he feels as though his mind is a little bit sharper. But Karen is asking if Metanex might help with claudication pain. And I'm wondering if there's an indirect way, maybe with the reduction in inflammation, not as much damage to the arteries.
It could be with the inflammation because It also helps the nitric oxide kind of pathway. So there could be, I don't think there's any studies on that. When I was looking through the various studies, I was, you know, kind of seeing how it benefits PAD but I didn't see anything on claudication. So I'd have to look into that one.
Yeah, I just wonder, I think that, reduction, it's just like the semaglutides, and they're talking about how those particular diabetes and weight loss drugs have the ability to increase, um, the walking distance and improve, claudication symptoms. And they say that one of the main reasons is just the reduction in inflammation alone is having a huge impact because of those drugs. So if the B vitamins help also reducing inflammation, then there might be some sort of, but there is no, as Nurse Practitioner Deidre said, there is no clinical evidence at this point that we've seen on that in particular. But overall, I mean, when it comes to the nerves, I think that Ange is definitely proof. My dad is proof that it can, in some cases, have an impact, right?
Hmm. Yeah, I would say in many cases have an impact, and especially if you're out there doing the walking programs and everything. And I know that the Global PAD has some great and education out there of how to like improve PADs. So make sure that you're out there walking and doing those things as well.
Those are so important. All the lifestyle modifications. Well, thank you so much, Nurse Practitioner Deidre. And if people want to follow you, if they're in Ohio, they want to come see you. In fact, we had someone that called in last week and is going to see you as well. What you offer is very rare. It's very comprehensive and personalized. It's not covered by insurance, but you do the advanced testing, you do the advanced supplementation. So if they want to get in touch and they can, where can they go?
So our website is aspirewih.com, and you can actually book a complimentary discovery call just to ask some questions and even see if we're a right fit for you as well. And Ashley, our health services admin, does an incredible job of just walking people through this health journey. So that's a start. And then our socials are Aspire Wellness Integrative Health.
Thank you so much, Nurse Practitioner Deidre. We really appreciate you being here, always volunteering your time and helping us with such great information. If anyone has any additional questions, you can call the Global PAD Association's Lifesaver Hotline. As Nurse Practitioner Deidre says, we have a great walking program, diet program, as well as smoking cessation program to help you just mitigate those risk factors for cardiovascular and vascular diseases. So thanks everyone for joining us. 1-833-PAD-LEGS is the number, and padhelp.org.